It's 2011 World Malaria Day. The incidence of vector-borne diseases, particularly malaria, has been increasing at an alarming rate in recent years in Nigeria. And the havoc wreaked on the masses cannot be allowed to continue unchecked. I'm therefore very happy that time and resources have been set aside to address this very serious issue, particularly the issue of malaria and especially how it affects our citizens in Ekiti State. At this point, I'd like to once again thank Dr. Tolu Arowolo for her thought-provoking presentation. You have given us a lot to think about as government leaders and as healthcare officials, and I'd like to assure you that all the issues that you have raised and all the recommendations that you have put forward will be fully addressed. Available data at our disposal tells us that 60% of hospital attendance is due to malaria. And a lot of us can attest to this. Anytime you run into someone and they say, how are you? I've not been feeling too well. What's the problem? Mo kàn ní malaria díẹ̀ ni. Kò sí nǹkan tó ń jẹ́ malaria díẹ̀. Malaria ń jẹ́ malaria. Kò sí díẹ̀ nínú ibà. And because our people are used to going in and out of hospitals because of these diseases, it seems as if we don't take it seriously enough. We don't take the prevention seriously, and we don't take our cure seriously. So we need to address this as a public health concern in Ekiti. Our figures also show that 30% of infant mortality is due to malaria. And the very creative performances we have seen today from our art practitioners shows that these beliefs are very strong in our community, that if a child dies or if a child is ill, it's because some witch or some neighbor or some mother-in-law has put a spell on them. We are also aware that a huge amount of money, at least 1 billion naira, is lost annually due to absenteeism in workplaces, schools, and the treating of malaria disease. We are also aware that 1 out of 10 pregnant women dies of malaria disease, and that malaria kills faster than all other diseases, such as HIV/AIDS, TB, cancers, and so on. Because of these reasons, the timely intervention in waging war against this disease by the federal government, international organizations such as UNICEF, the Rollback Malaria Global Fund, Family Health International, Sustainable Healthcare Initiative, and Society for Family Health, and so on, and the state government is a most welcome development.
The senior, let us put our hands together for her. And also want to recognize, and also special assistant to the wife of the governor, him. And also finally, let us call her Iya Ibeta. We will be listening to the welcome address for Le Olugoji.